Okay, hi, it's Elliot Fishman, and I had something done here, which is nothing big, but so that I wouldn't get a black eye, they put this um, pressure thing on, so it kind of makes it look like I've been in a fight, but all is good. And so I just want to welcome everybody. Today is August 12th or 13th, I think it's the 12th, it's Thursday. We're doing it late at night because I thought, not late at night, 5 o'clock. I thought maybe we'd look at different times. I know there's no good time worldwide or even in the US for everybody, but I thought we would do it now and see if we get more attendance. We get a lot of people who come on after the call, but then they can't ask questions. So we're trying to see what time is best. And I know there's no best time, and this will be on Facebook Live after, this will be on YouTube, so everybody can see it later. But it's just something we're going to try. So this week's topic is CT scan protocols in COVID. Now, when you read that quickly, you're going to say, oh, we're going to speak about protocols for scanning patients with COVID or patients who are scanning for complications of COVID. Okay? Now, that's not what I'm going to speak about. Okay, what I'm going to speak about is because of the 18 months we've been in this COVID bubble, I've noticed that the scan protocols, the quality of the scans has gone down substantially. Now, I look at a lot of outside CT scans more than ever because of the fact patients often couldn't travel here. So I'm not being critical. We've had challenges here as well at Hopkins. So let me talk about the challenges and what you need to do. When COVID hit, everyone, rightly so, was extremely careful. Finally, we're getting patients to wear masks, patients with COVID positive. Something as simple as drinking oral contrast through a straw or a cup, you don't want to do it because you don't want the patient's masks off and contaminating the room. It wasn't the COVID patients only, but the potential COVID patients, the PYs. It was the regular patients. Patients were scared to wait in the waiting room. We didn't let them. We had people wait in the car. We weren't able to prep the patients. We get them down, put them in the room, get them out. I think now, I decided to give this talk a few weeks ago, and then of course COVID's gotten much worse with the Delta variant. But I'm here to say that particularly with patients who are vaccinated, when you know patients are safe, you need to be extremely careful with all patients, right? Because we know even with the patients who are vaccinated, which is more than 70% of us, still a lot of patients are getting COVID with breakthroughs. Fortunately, it's not severe, but you still need to be super careful. But we need to really be thinking about the scan protocols. And so what I've noticed is on the oral side, patients aren't given oral contrast. They need to be given oral contrast. Perhaps do it before the patient comes down to CT or comes from the ER when they're in a room by themselves. Whether it's positive contrast or neutral contrast, we need to have the stomach distended, the bowel distended, or we mix a lot of pathology. Same thing is true in the CT scanner area now. As patients are a little safer, you can give them a straw, they can take off their mask, drink it, and then put their mask back on. We need to really rethink and make sure we're doing the protocols correctly. The same thing with IV contrast. We need to be using IV contrast. I see more and more scans done without oral, without IV, and you're missing things like crazy. Or the contrast injection is so poor that if there was something there, I wouldn't see it anyway. You're looking for hepatoma, and you're basically giving 1 cc's a second, and the timing is totally irrelevant. You need to get back to doing the studies at the right protocol, at the right time, right position. We really need to be careful about that. We also need to be careful in choosing the right protocols, whether it's single phase or dual phase. We need to be paying attention to that. There's no doubt in this COVID era, all of us are short-staffed. Many techs have left. Some have gone from hospital A to outpatient center B, from outpatient center B to outpatient center C. Lots of turnover, which is really sad. We've lost many great people in CT, MR, and ultrasound, so we are kind of hurting there a bit. But it's more than that. People have been overworked or stressed out, wherever you are. I know it's been really hard. I mean, people are dealing with their professional lives and their personal lives. Many of the technologists are younger, they have children, the children often didn't go to school, there was lack of coverage, all sorts of things, and I am as sympathetic as I could possibly be with that. So do not get me wrong. I know how hard it is, and I know how hard it continues to be. But in saying that, we really need to double down our efforts in doing the studies correctly. You've had no meetings, there's no staff meetings for the technologists like there used to be. You don't discuss protocols. Everyone is kind of working super hard getting things done, but they're not always done correctly or as correct as they could be done. So I think that becomes very, very important. I think if you're not having meetings in person, like most people aren't, what you got to do is you have to do remote meetings, do Zoom meetings. You can do a couple meetings. You can't get everybody together. People are working. Do 2 meetings instead of the one you used to have, or do 3 rather than 2. Make the meetings shorter, much more defined. Do it early, do it in the middle, do it late. People need to be thinking. We spend so much effort worrying about COVID, rightly so, do not get me wrong there, but you really need to take a step back now and say, okay, what have we sacrificed? What aren't we doing that we should do? How can we make it better? As we come out of COVID, again, it's going to be a little bit longer than some people thought. I was one of those people who did not think we were coming out this summer. But you just need to really be conscientious of things and do the studies correctly. Again, you do less studies if you do them correct. I think education has suffered in the COVID era, or lack of education. I think CTisus, we've doubled down. We have more lectures than ever. We have more cases than ever. We have really tried hard, both on Facebook, on Instagram, on YouTube, on Pinterest, on Twitter, on our website, ctisus.com, to really provide outstanding information about everything that needs to be done, focusing on protocols, focusing on what you do need to know. You can ask John Biacchino. John is in Pittsburgh. John must be traveling. John's one of our great senior techs who usually is either in the scanner or he's in Timonium, Maryland, which is 14 miles away where he lives, but now he's in Pittsburgh, PA. Hi, John. But I think it's important to really be focusing. We're doing some quality assurance measures at Hopkins. One will be looking at the stomach, one will be looking at contrast. Again, whether you're outpatient center or you're inpatient or somewhere in between, you really got to be thinking about and looking at your scans. See what you're doing right, see what you're doing wrong. Hey, Lydiana. Lydiana's saying hi. Lydiana's, I think, back home. She was in Las Vegas last week. I saw some great pictures she sent me. I haven't been to Las Vegas in a long time. I've been to New York, but not to Las Vegas because I can't drive to Las Vegas. I think everybody in the east side of the country, east of the Mississippi, seems to think they're having Las Vegas type weather now, because in Baltimore, for example, on the East Coast, it's at 95 degrees, which is bad enough, but the humidity is, I don't know how high it is, but it feels like it's 110, which is Las Vegas temperature in July, though Las Vegas this year was doing the 115, so it's really, it's been tough on the weather. So hope everybody is keeping cool and keeping safe. I think, with pets, with children, and yourself, when weather gets that hot, perhaps the best thing to do is sit around either in the pool. If you don't have a pool, if you don't have a bath, sit in the bathtub. If you don't have a bathtub, take a shower. If you don't have either of them, just sit inside, turn up the AC, and enjoy yourself. What else can I tell you? In terms of protocols, we are seeing a bit more of COVID patients now. I think the people who are really suffering are people in Florida. You see the numbers, Tampa General, more than 20% of their inpatients are COVID related, 61 in the ICU. I read that in the paper yesterday. So their numbers are just amazing in Florida, Texas, and Louisiana. So we hope all the healthcare professionals there are doing okay in this very stressful, whatever considered fourth wave of COVID. I think states with bad leadership, and I'm not a politician, I don't want to be political, but the Florida governor, I don't know, you know, I don't know what that guy's thinking, how he got elected, how he hopes to be elected, because all the people who vote for him are going to be sick or dying because they're not wearing masks, they're not getting vaccines, and they're behaving not the way you should behave in the middle of a crisis. So, not to get political, but I think CTisus from the beginning, from January, even before January, we said when the vaccine comes, get the vaccine. We're doubling down. Get the vaccine. No matter where you are, whether you're young or old, if you're over 12 years of age, get the vaccine. The vaccine will be life-saving. Yes, you could get COVID. Let's not, but catching a cold, even a bad cold, is not the same as dying, right? I don't want to be threatening. I don't want to make people scared. Here's Rebecca. Florida Keys, we're getting a surge. We are tired. And Rebecca, our heart is with you. Errors happen, mistakes happen. There's only so many scans you could do. There's only the doctors, whether in the ICU, in the ER, radiologists, non-radiologists. It's just overwhelming. The same thing, our technologists, our nurses. People are getting burnt out. People are getting stressed out. Mental health issues are developing. I never like to overplay or underplay mental health issues, and there always is a problem with mental health. But I think many people now are really having problems. Many people are struggling. There was a woman who you read about in the paper, 36-year-old radiologist, I think 3 kids, a little bit postpartum, committed suicide. I mean, it's just, it was in the papers. It's just unbelievable. Here's Greg Martello. Numbers in South Jersey are going up again. You got to be careful. I think, the beaches, I was speaking to someone yesterday who's in Ocean City, which is the beaches and connects up to New Jersey somewhere or other. Same thing, no one's wearing masks. A lot of young people at the beaches, but no one's on the boardwalk wearing masks. No one's in the stores wearing masks. That's the problem. We don't want to wear masks. You got to wear masks. The U.S. government, every industry, Live Nation does all the concerts, said no mask, no concert for you. Okay? I agree 100%. This thing Eric Clapton a couple weeks ago said, if any place which says no mask, that mask is required, he's not going to play at. I love Eric Clapton, but Eric, baby, you're way off. Eric, the only thing you're going to be playing is small theaters in Florida or Texas, in bars, because the only place that's going to allow you not to wear a mask or not to be vaccinated is going to be that. Live Nation all the big concert halls are Live Nation, or almost all of them, and they are saying no vaccine, no entry. I agree 100%, and so we are concerned for all of our colleagues. I know you need to have, like New York, strict rules, no restaurants. I think, again, our county is requiring masks. We don't care what the governor says, and that's the right thing. I saw in Florida, what was it, where the governor said that you were not allowed to have masks in public school, that if a school district required a mask, they weren't going to fund them. Are you kidding me? I don't know why people don't recall the guy. You wonder how he's managed not to get COVID. 3-1, like our ex-president, he got a vaccine the first day, got to the front of the line, never showed a picture of that vaccine, of course, because he would not want you to think he got it, but has little concern for all the constituents. So our heart goes out to everybody in the areas. The Florida numbers seem to be terrible. One of my patients, who's probably in their late 70s or 80s, called me up the other day that she and her husband both tested positive. I'm going to give her a call on my phone when I finish this on the way home today to see how she's doing. She called me over the weekend, but she seemed to be doing okay, and she had been vaccinated. I think, guys, everyone's revaccinated sooner or later again. I think sooner than rather than later, probably September, October. Here's Greg. I live in Ocean City, New Jersey. So I was thinking, yeah, I was thinking Ocean City, Maryland. So I think there's two Ocean Cities and there's Rehoboth in between. But I think every place where there's a boardwalk and a beach, people think they're safe because they're outside, and the ocean breeze is going to take everything away. Whether you're in the ocean, it's better to be outside when the wind is blowing, I agree, but whether you're in the ocean, whether you're on the boardwalk, whether you're on the beach, whether you're in Walgreens, whether you're in Walmart, whether you're wherever you are, just err on the side of caution. Wear a mask, have your kids wear masks, behave. We don't want to end up in the hospital, and we need our other people. I mean, as Rebecca says, they're so stressed out. They're tired. You, our techs, are tired. You, our doctors, are tired. You, our nurses, are tired. Maybe the administrators aren't so tired, but you guys are exhausted. It's been 18 months of working really hard. At CTisus, we are with you. We're behind you. So the only thing we could say is for people to do the right thing. Now, hopefully, we have 2 million people on Facebook, on CTisus. Hopefully 2 million people have gotten 2 doses of the vaccine or 1 dose of J&J, and hopefully you are doing everything right. So I think my time is about up. Let you know also, just in terms of education, I've been working really, really hard on new lectures. Often I update lectures, so CT of liver masses I'll update every couple of years, but I've been working on new lectures. I had a new lecture on aortic trauma, and they're coming up over the next few weeks. Had a new lecture on cystic pancreatic tumors, SPEN tumors, a lecture on mucinous tubers. I have 2 new lectures I'm finishing up today. One is on splenules, believe it or not, and one is on acute gastric emergencies, like perforations, bleeds, stuff like that. So we're trying to really provide new information. And I will say also that if you have requests, I always ask people to tell me what they want me to tell them. People say, whatever you want to talk about. Well, I want to talk about the Beatles reunion, but that's not what I'm going to talk about. So anyway, I do wish everybody a great week, and keep cool. Stay out of the sun. Don't, hope everything's pleasant by you. But wherever you are, be careful, and tell other people to be careful. So with that, I wish everybody a great week, and I'll speak to you all soon. Bye-bye.